Okay. Okay.
So it's moving, and I feel like there's a little more wiggle room everywhere.
Mhm.
Everybody's getting more. Like we had J&J, so for a couple weeks, well, 2 weeks maybe, we had enough. We were offering it to people as they were being discharged
Oh, wow.
without really any, they didn't have to really meet any criteria. We were just giving it to them as they left.
Okay.
So some people would take it, and some people were totally saying, no, I don't feel comfortable. I had somebody who she said she'd take it. They brought the shot down. She saw the shot and she goes, yeah, I don't really think I want it anymore. And thankfully we found somebody else to give it to, but because they only, like, there's 5 doses in a vial. So they would only open a vial if 5 people agreed to it.
Interesting. Now, I went to the CVS in Little Silver. Jim had to go to a CVS in Middletown for his. The guy in Little Silver, I think they were only giving about 15 a day. But, he was very nice. He asked a few questions. He asked me if I had a bleeding disorder.
Yeah.
Not that I'm aware of, I said. I don't think so. And a couple other questions. He was very nice. Guy got the shot. But that was it. And then my girlfriend, who's actually giving vaccines over at Brookdale, she said that, well, did he give you the sheet that from the CDC so that they can actually keep track of like how you feel and that kind of stuff? And I said, oh, but she gave it to me.
Yeah,
so
there's that.
I get a text every day. How are you doing?
How do you feel? Did your arm hurt?
Did your arm hurt?
Side effects? Did you have a fever? Did you? Right. So I think you get it for a week or 2 weeks straight, and then you won't hear from them.
Okay.
And then you'll get once a week. Okay. How do you feel? And then you get a reminder to go get your, well, you won't because you don't need a second shot, but I got a reminder to go get my second shot. And then it was the same thing over again. How do you feel? Did you have any reaction?
I thought that's exactly what should have been. I was surprised. And Jim wasn't told that either when he went.
Yeah, it's a voluntary, it's really for the CDC. It's a CDC fact finder more than anything else. So CVS may have felt that they didn't have to be a part of it. It's not a mandatory thing that you do it.
It seemed like a good idea though. I mean, the whole idea.
Well, and if you read all the information that they give you, you'll never take another shot ever again from anybody for anything. Exactly. I started to read it, and Ron goes, "What?" I go, "Yeah, I'm not going to read it."
You're right.
I've already decided I want it. I know the other side of it. I'm not taking any chances. I'll just. And then Timmy got it in Philly.
He did. Oh wow.
Yeah, the week after he was here. It was very exciting times at my house.
Can you guys hear me okay?
Yes, AJ. Yep.
Okay,
I hear you.
How's everybody?
Good. How are you?
Good, thanks.
Are you recovered from your miles and miles of walking?
Yeah. That was a bit of a distance. Yeah.
That's a great idea. That's a great idea, but I'm not doing it for my 30th.
What did you do, AJ?
You walked 24 miles for 24 years.
Did you really?
Well, we tried. We tried a mile a year, and we got to Monmouth Beach. We walked from here, went through the greenways, Little Silver, then we went down Branch into Red Bank, and then down River Road, went over the bridge into Hartshorn Woods, up to the Twin Lights, then over into Sandy Hook. And we ended up taking a right. The weather was just so windy. We ended up taking a right-hand turn. We got to Monmouth Beach, and at like 21 and a half miles, we threw the towel, and the sun was setting, 25-mile-an-hour winds. It was miserable.
It's a good try.
Yeah, we tried.
Good try. Let's see.
Yeah, I think I've been married too long to try that, but it's a nice thought.
Yeah.
Well, if it's a nice day, it's nice.
I think you might go to 20 and then maybe work back. Like year 21, do 19 miles, and year 22, do 18 miles. So I think that might be the way to go.
Well, that would get me down to 10. That would be good.
That would get me to 10 too.
Doable. I saw a post over in Red Bank where they're walking for cancer. I think it was yesterday. They were walking 40 miles. I'm like, after trying 24 and failing, I'm like, there's no human that can do for you. I'm sorry, in a day.
Not yesterday. It was horrible.
It was horrible. Yeah, last week, that's when you should have been walking.
Yeah.
It was 60 degrees.
Hey, Brett. Hey, David.
Guys. So we're, I
Are you
know,
at baseball practice again?
Yes, at baseball again. It's every Tuesday night, so.
so maybe you should have like a different car every meeting. No, I'm kidding.
Pretty soon you'll be sitting outside.
Yeah.
Yeah.
No.
Well, actually, I won't have to drive that far. So I could drop off and go home.
There you go. Nice.
I'm all the way down in Neptune right now.
Oh, wow.
I wonder what special guests we'll have drive up next to you this time.
But look, it's not dark.
No, it's not dark out. Yeah.
It's dark.
I love daylight savings time.
Oh, me too.
The first week is tough, but it's worth it.
Yeah.
There's a bill to get rid of it.
I know, that's what I hear.
I think every year they try to get rid of
They
it.
always talk about it, I know.
Yeah.
Can we get rid of standard time instead?
Yeah.
Mm. So we're not waiting for Eileen. She's unfortunately not able to make it. And Dr. Rekedahl, I'm assuming, is coming, but I haven't seen him yet. But it is 7 o'clock, so you're welcome, Brett, to do whatever you'd like to do.
Okay. We can get started. So we'll call the meeting to order. Has anybody talked to Kelly O'Brien?
I have not. I had attempted calling once, and honestly, I completely forgot about it. Dr. Sullivan, have you seen her at all?
I have not seen or called her, and since I gave you her phone number.
Yeah, it went off my radar. And, so I will, I'm making a note to put it on my radar. After this meeting, I'll give her a call.
Okay.
Yeah.
Is she okay? Does anybody know? I mean, is she all right?
Yeah, her plan had been she wanted to spend more time at home with the kids.
Right.
There was a misconception that she had sold her home, but she's still in the same place. They had sold another house on the street that her mother had lived in.
Okay.
But she's still in the same place. Her background education is as a nutritionist, and she planned to donate time to lunch break
Okay.
Oh, great.
and be around for her kids. That was the plan when I spoke to her.
Okay.
I will give her a call after the meeting and see what we can find out.
All right, so the reading of the February minutes. Everybody had a chance to read those?
They were nice and long.
I know.
I did.
I try to abbreviate, but
Yeah, it seems like the last couple of meetings, they've been really long.
a lot of good stuff to talk about.
Yep.
It's interesting because you see the whole progression of this,
Yeah.
how things are going when you go through them.
They're
I
all
make
good.
the motion to approve.
A second.
So moved. Okay, so then we have the reading of the clerks and the registrar's report for February. Clerk and registrar.
Motion to approve.
Second.
So moved. Okay, health officer's report.
Yes, good evening, everyone. Hope everybody's doing well. But as you can see, I think Heather had sent over my February report and January report. So we've been just keeping quite active, basically. I will mention that what we've been seeing lately, the state has seen a overall reduction in the number of COVID cases, which is good. But what happens is we've seen to have hit a plateau. So we're seeing much more activity amongst the schools and the younger people at this point. So, we've been working with the schools like 7 days a week through, in various situations. So we don't have any definitive explanations for why we've hit a plateau and not dropping any lower. But, we kind of think that it's the variants that are out there and just more activity and probably some fatigue amongst the people in regards to the public health recommendations and mandates. So that's basically what we're seeing at this point in time. And besides that, the Monmouth County Health Department is continuing with the vaccination program. My public health nurse manager and myself, we're in the process of trying to become a vaccination site. So we have to go through another process. Then we'll be put on the waiting list until there's sufficient vaccine available out there. And we have reached out to the VNA, and we're in ongoing talks with them to see what they can do to help us out with vaccinations. But so far, they've been working very effectively with the schools, trying to vaccinate the teachers. They've also been vaccinating on some senior programs throughout the county as well. And I think, Betty, you've kept excellent notes. So it seemed like I talked a lot last 2 months.
But you say worthwhile things, so that's okay.
Oh, thank you. But yes.
Dear, I'm sorry to interrupt. A question. We talk about cases going down and hitting a plateau. Yet looking in the Asbury Park Press on the weekend for the number of positive case tests by town, it seems that the smaller communities like Little Silver, Fairhaven, Rumson, Oceanport are proportionately seeing more positives than like the larger towns like Red Bank and Long Branch, which 8 months ago, they were the ones that always had disproportionate, their numbers were much higher than what we were showing in the smaller towns. Is that because of the schools?
It probably is, because what happens is there have been a lot of students that have been placed on quarantine, and the parents have been taking the kids to get tested in regards to that. And then a lot of people are looking to go on vacation for spring break. And so one of the state recommendations is that they go get a test before they travel. So, between those two items, that's helped bring a uptick in the amount of testing that's occurring.
Have we seen an uptick in the hospitalizations?
No, it continues to go downward, and it's the same with the long-term care facilities as well.
Well, if younger people in schools are the ones with the positive test, that might explain it, because they usually don't get as sick as older people.
And actually, Tim, one of the switches ended up being that I was allowing some of the younger kids to come back, or recommend some of the younger kids to come back to school for more full days, because the data just showed that there wasn't a lot of activity in the younger crowd. Now we're down to even the kindergarten and pre-K. Positive as well. So that's kind of concerning to us. And based on the public health intelligence briefings that we get every week, it just seems like Monmouth County continues to stay in a high zone. I think today and yesterday, we were either number 2 or number 3 in the state for the amount of COVID cases. It's hovering around 300 a day.
Wonderful.
Yeah. So, we're continuing to try and foster the public health message, and collectively working with everyone else, trying to get as many people as vaccinated as possible.
Thanks, Dave.
Yeah. Any other questions at the moment?
David, it's AJ. Thanks for coming on again.
Hi, AJ.
How are you? I've kept Brett up to date and Betty Ann up to date on our efforts here in town to get our seniors vaccinated. Is this a good time to talk about that now?
Well, let's leave that for old business.
Okay. I just wanted David, if you have to jump off, I can give you an update tomorrow.
Okay.
Okay.
All right. Thank you.
Okay.
Okay, so let's Betty, any correspondence?
You just have to approve the health officers.
Oh.
Report first.
Motion to approve.
Somebody want to second that?
I will.
So move.
And no, we don't have any correspondence.
Okay, any new business? Actually, AJ, you could talk about that under new business. That's fine.
Okay. So last time we had a meeting, a lot's happened since then. Laurie's comment, and I think Betty Ann as well, the idea was at that point, I guess it was a month ago, we were trying to figure out, what sort of effort we should do and how we should do it. And the suggestion was, let's just get them registered, right? Because we really didn't know what was available in terms of supply, and so a lot's happened since then. We had reached out to Riverview. We had reached out to a couple other locations where they were doing vaccinations, and we were kind of coming up empty-handed. So what we did is we started with the Little Silver Helpers, and we took that list by age of everybody here in town. And Little Silver Helpers went down that list from the top. That was Betty Hansen, who's 104, and went right straight down. And it was quite difficult for them to get a hold of any of those people. People don't answer the phone. It's just, today it's very hard to get a hold of people. So we kind of came to a dead end. We got a few people that we were able to get a hold of to help them register on various sites. But where the breakthrough happened was when Declan O'Scanlan got in touch with us and said, hey, I can get you guys fast-tracked on your most vulnerable in town, the seniors and the eligible. And we took that, and you may have seen the public messages that we put out on our town website, on our Facebook page, and we sent it out on Constant Contact as well. It's a little tricky. I share a Google Sheet with Shauna Sullivan, who is Declan's chief of staff. And what that link does is it takes you right to the VNA. So I think it's actually the same link as the VNA. Requires seniors and eligible people to upload their passport, not their passport, their license, or any ID. It could be a passport, as well as their insurance card. So that's a bit of a struggle with the VNA site. From what I hear, it's the most difficult site to deal with. Because of that, it actually requires 4 separate JPEGs. So, you can imagine asking a senior to do that kind of creates a bit of a problem. And the way we got around that was Little Silver Helpers, the people they could get a hold of, they actually went to their homes in a lot of cases and acted as advocates. And so we got people that way. And then the next step we did was we reached out, and David, I think this is an idea for other towns, because I know Vingo Paul is doing the same thing that Declan has done with his towns. They create a fast track, whether it's to Hackensack or whether it's to the VNA. Little Silver is being directed towards the VNA. And we actually to get to our seniors, we went to the community. So we started at Alderbrook, then we went to Cheshire Square, and then we went to the townhomes. We spoke to the homeowners associations. We found the people that had the emails and the telephone numbers, and we provided them with the language that they should be communicating out to those residents. And to date, we have about 80 people on the list, of which about 27 have been vaccinated. As a result, Betty Hansen being the number one that happened on, I think, February 26th. I hope I'm not repeating myself. Some of you probably know all this already. So we continue the effort. I spoke with Shauna Sullivan again today, and she already grabbed everybody on my list. So we've got 80 people that have been submitted to the VNA. So what happens is people need to sign up on that link, but then they have to call Kim in town hall, or call me, or email me, or town hall, so that I can put them on the list. So it's quite a complicated process and requires advocates. I think our next step is to reach out to the community and just suggest, look down your street. Do you know a neighbor that might not be vaccinated that is eligible, and check on them and see if they need it, because we only have 80. I think a lot of people may have done it on their own, but we've got over 1,300 people that are 65 and older in our town, and that doesn't even add in the other eligible for health conditions. So there's clearly a lot of people out there, and I'm sure they're, from what I'm hearing, they're not vaccinated. So I just wanted to go through, let's see, I want to make sure that I covered everything.
AJ, after our conversation, I mean, we're doing it in Fairhaven as well.
Yeah.
Through the Hackensack one though, because it's a little easier to, people don't have to be registered with the VNA, because sometimes the VNA portal is closed. It makes it a little more challenging. So after speaking with Shauna, we opted to do the other direction, but the same thing. We've got a couple of volunteers in place there that are tenacious about trying to get these seniors appointments. One woman has been very successful, and we're still getting calls. I had a few calls today of people that heard about it and wanted to have some assistance. And so even though the numbers aren't large, there are still people that are, the word is beginning to spread even more that this option is available. Another, it's just another one. We're trying not to make too many promises, that it's absolutely going to happen right away, but at least, like Laurie had said, getting them registered, and at least that connection I'm sending to Shauna as well.
Just so you know, Hackensack drops appointments on Tuesday.
Oh, they do?
Yeah.
Okay. It's good to know. Thank you.
And we found that with the VNA as well, that all of a sudden there's a slew of, because I get phone calls when people get appointments, and it's just the phones blow up. So it seems to all happen at once.
Okay.
So we had, I've gone probably 5 days without hearing anybody getting appointments, and then all of a sudden you get a slew of people that say they got emails. So.
Okay.
But as more towns pick up on this, I think, Betty Ann, you're right. You got to manage the expectations of the residents, because there's no guarantee, but we've had very good turnaround.
I think it's going to get easier and easier. I shouldn't say easy. I think it's that the vaccines are becoming more available. I think it's going to be easier to register people and easier to get vaccines, especially if you meet the criteria in the next couple months.
Yeah.
Even in the next month.
I think March 15th also being open to the teachers. I know there was a big effort with Declan and a number of the other assembly people in various towns and various districts that were pushing the teachers ahead of the March 15th. But I'm pretty sure that within the next week, all the teachers will be done that want to be done.
Yeah, I was in school on Friday, and like 10 teachers had gotten texts that day that they could go and get their shots. So
yeah, so I think I think one second, Mike, I'm just guessing, and maybe David can speak to this, but I'm thinking the governor is going to be opening this up, whether it's next week or the week after. You know, as I think the VNA and Hackensack and the other mega sites start to say that the numbers are dropping off in terms of people showing up.
And I think as we get more of the J&J vaccines, the fact that it's just a one-shot deal,
Yeah.
you're not going to have those same people come back for their second shot. So you're going to have greater throughput with the J&J.
Yeah.
Yes, Tim and AJ, what happens on recent state health call? They're prioritizing the J&J vaccines for the harder to reach communities. So besides the homeless and the homebound seniors, you know, that's going to be one of the efforts to spread it out to the senior citizens as well in their process.
David, for someone that is homebound and can't go out, how would they go about getting the vaccine?
Well,
Is there a particular number that they need to call?
There is a number on this the state website, which we put on our website recently. But the VNA is basically for our towns. They are the ones that kind of keep track of the homebound with the visiting nursing services.
Right.
So they would actually try and prioritize the folks on their list with their nursing visits. So I will check with VNA to find out what that process actually is.
Because and I ask because I have a patient who he doesn't receive VNA services, but he is homebound.
Okay. Yeah, I will find out the process and get back to you on that.
Okay, thank you.
I know the YMCA, when I asked that question, Brett, the YMCA said that they had wheelchair accessibility. But you're saying this patient can't even leave the home, is that right?
No, he doesn't. He can't walk. So it's very difficult to transfer him. You know, when he goes to the doctor, he goes by ambulance.
Got it.
And Brett, also too, we get monthly reports from the county on oh gosh, it's the 211 calls for those people who are homebound or disabled and things like that. So
Okay.
they have a list for Little Silver, and I'll have to take a look at the most recent list to see what data I can find off of there. They share that data with the police departments as well.
Okay. So is there a special number that he can call, or?
Well, let's see. This is coming out of the Monmouth County Medical Reserve Corps.
Okay.
Yeah, at their standard number. I'll have to find out what's the quickest way to get through to them, because I've called the county a couple of times, and obviously they're at the vaccination clinics. So I'll try and get a email address or in contact with the person who takes care of the Medical Reserve Corps, who looks at this all the time.
Okay, great.
Yeah, we took my father to the Y with a wheelchair, and it was very smooth. You know, he's not able to stand for a long period, so we took the wheelchair just so that he wouldn't have for waiting in line, and they have it down to a science.
Yeah, from what I understand, the Y, Brookdale, they have it down where people are in and out. There's no waiting. I did hear a story that someone went up to the Meadowlands. They had a 10 o'clock appointment, didn't get out of there till 4 o'clock.
Oh.
So, you know, some places are a little bit more efficient than others. Obviously, the Meadowlands is seeing a lot more people than Brookdale and the Y. So.
I was at Brookdale today, and wheelchair access is easy in and out. There was a little bit of a line that built up around 1 o'clock because they they closed down from the morning session and then reopen at 1 o'clock. But we got people in and through really very quickly. I think the total for the day was about 1,000 or so vaccines. So it's, and I was asking people, did you have to wait out in the cold? And they said, no, they really came right in. So.
The VNA is sending our residents either to the Y or to Homedale Bellworks. That's what we see. That's what we've seen so far.
I wonder how it's working over at Bellworks. I'm sure it's running smoothly over there as well.
I know a lot of the Alderbrook community went and they came back happy. The
Yeah.
reports I'm getting, they're happy. Yeah.
Well, I was impressed with I went to the Gloucester mega site for my first shot, and it was, I think they probably have about 10,000 people a day, but yeah, I thought it ran very well.
Yeah, I'm sure the procedures and everything are pretty well run. It's just they're over, the amount of people that are coming through.
Well,
It's just
and
overwhelming.
that still doesn't, like you said, solve the problem of the people who don't know how to get themselves get access or
Right.
get themselves registered.
Well,
Def-
for us now, we have a way. So, point anybody that you speak to the website. It's on the front page of the website. There's a link. It's perfectly clear how to do it. The other thing, we've received a couple of emails recently at the council level from residents concerned about the uptick in numbers, and that David mentioned and that everybody else is sees if you're looking. And what Don Galante has been doing from the very beginning is keeping track of the 14-day active number here in town. And Don's putting that into a graphical form, and we're gonna put that on the website. So, a picture tells you 1,000, it's worth 1,000 words. You're gonna be able to see, exactly what the 14 days. So, the 14-day number being, anybody gets tested positive is on that list for 14 days. Is that right, David?
Yes.
Right. And I think Little Silver's up in the 50s right now. So it's a little bit concerning. That number is most certainly ticked up. Yeah. So I think people see that in their town, maybe that fatigue and that feeling that it's over might give people pause if they see that chart. Yeah.
I have suggested to people that have received their vaccinations that they take a picture of that CDC vaccination card with their cell phone. So in case they misplace the card, they have that information. Nobody's really asking for it now, but for example, I think it's Celebrity Cruise Line just announced that they're going to offer cruises out of Israel to the Greek islands and Cyprus. But to get on board, all crew and all passengers have to show proof of vaccination. So hold on to those cards, because down the road, you may start seeing local cruise lines or airlines wanting to see that.
That's a good point.
I guess I'm wondering how we're doing with things like mask compliance, maintaining distancing, some of the basic measures like that. I mean, right now the vaccine is putting a pretty strong downward pressure on the virus, but the virus is managing to create escape hatches out the sides, mainly by mutation. And the only way you're going to really tamp down mutation rates is by decreasing replication rates. So the non-pharmaceutical or non-pharmacological methods of containing the virus continue to be really important in terms of whether or not the vaccines in the long run will be successful. So do we have any information on that other than impressions?
Yes, basically, this is Dave again. So basically, what we've been doing is we've been continuing to put that message out on our website and through Facebook that now is not the time to relax the public health strategies and mitigations as we wait for more vaccine to come through. So, we continue to do that. The state health department continues to do that as well. So we're just continuing in that direction at this point.
Yeah. Unfortunately, we can vaccinate against the COVID virus, but you can't vaccinate against stupidity. People will do stupid things.
Very
Perfect.
true. Very true. Put that on a t-shirt.
Can I ask, what's going on in our schools right now in terms of distancing and ventilation?
So as far as distancing, the kids are in a mask. They're 6 feet apart, and they do have the plexiglass partitions.
Mm-hmm.
And this is the first week they increased the school day from 12:30 to 1:30, giving the kids an in-school break for a snack for about 5 minutes, and then continuing on with the day.
And we've been working with the schools basically 7 days a week. I think I was talking to the superintendent of Red Bank Regional at least 3 times over the weekend. So we continue to monitor the cases and the upticks in the school system as well.
Did RBR reopen on Monday?
I think it was today.
They did, yeah. I had an empty house today.
Yeah, what I'm seeing at Markham, which is, I was just, my observations is it's hard to keep the kids apart, but they are very compliant with the masks.
And the schools remain our success story at this point. It's basically the least riskiest place to be at this point.
I did hear this morning on the news, they released that the CDC recommended, well, not recommended, but said that in the schools that the social distancing could diminish to a 3 foot social distancing, which I think is a big mistake for them to release something like that. Because now now kids are gonna hear that and they're gonna think that they don't have to stay apart, inside the classroom, and we all know that they don't stay apart outside the classroom and they keep their masks off. So, I think the CDC is kind of shooting themselves in the foot by releasing data like that.
And Brett, we were on the call with the state health department today. And the state is still reviewing the CDC documentation, but they have not decided what they were going to do with distancing. And we've been waiting at least 3 weeks to see the new updated K through 12 school guidelines. So they're still working on that at this point.
Right.
I think the 3 foot recommendation came out of a study from Massachusetts. It was a suburban school where, in fact, mask compliance was really 100%. And what they found was that if they used 3 feet versus 6 feet, there was no difference in the baseline rate of transmission that could be attributable just to the number of feet apart. But there have been other really good quality studies that have looked at the fact that it's really not in classroom transmission that is the problem. It's when it's in the playgrounds, it's either before school, it's in the lunchrooms, it's in all those other settings. And that's true also, by the way, in hospitals. For example, the Columbia Cornell hospital system has found that staff members who get the COVID are not getting it from patients. I mean, they're completely protected from the patients, but what they're getting it from is that they take a break and they go in the break room, take off all their gear and sit down and have lunch with their friends. And so it's in those times that I think are the most dangerous. And those situations are much more difficult for a teacher or administrator to control. So extending it out to 1:30, I think, is kind of pushing the limit to how far you can go without having lunch.
Well, yeah, and that's the big thing. And they're with the snacks, they have to sit at their desk. They have to be behind the partitions. But if you release them into the lunchroom, there would be no way to keep them from being on top of each other.
Get it. It's over. Yeah.
I think you'd have to feed them at their desk. Let them sit at their desk and eat lunch.
Yeah, that's what they're doing now. That's in their I don't know what the little kids do, but at Markham, it's in their EIO class. At the beginning of that.
Otilia,
Yes,
good evening. You have some news for us, don't you?
I do. Unfortunately, this will be my last Board of Health meeting with Little Silver. My last day at MCRHC will be on Friday.
Oh, no.
I've accepted another job. So this will be my last meeting with you guys. It's been a pleasure working for the town and having our monthly meetings, and I'll miss everybody.
Congratulations.
Yeah.
Thank you. Thank you.
Congratulations and best of luck.
Thank
Thank
you.
you very much. I
Congratulations and
appreciate
good
it.
luck.
Yeah.
Congratulations, Otilia, and thank you for the hard work and your millennial ideas and all talents and skills you brought to the department and the towns.
Thank you. Appreciate it.
And Dave, would you let us know who's going to be replacing Otilia?
Yes,
So we can invite her to the next meeting.
Yes, we will. I'll talk with Lisa, our principal REHS, to see how we're going to do that. I think initially we were going to rotate some people, some of the REHSs through, but I'll solidify that, and we'll be back in touch with you to let you know who's going to be the inspector to cover.
Thank you.
Great, thank you. Okay, any other new business?
That's it.
Well, no,
Okay.
this is Dave again. I just wanted to comment on AJ and Betty doing such excellent work to try and get the seniors vaccinated. I think that's a real wonderful way to move through everything and get more people vaccinated. So, congratulations and continue the great work.
Thank you, David.
Yeah.
And if there's any of your towns that need any advice or guidance, Shrewsbury reached out to me the other day, and I kind of laid out the playbook that we have put together that grew organically. So if you need any help, let me know.
Oh, thank you.
AJ, any word? Have you heard anything from Little Silver Pharmacy?
I called over there the other day. Ross was not in, he was off, but I spoke to one of the other pharmacists. I told them what we're doing because
Right.
we had initially approached them together, you and I and Chris.
Right.
And I gave them the heads up that that we've got a fast track going, but I wanted, as soon as they get the vaccine, to let us know, and because they definitely indicated that they are willing to
Right.
work within this idea of fast tracking.
Did they have any idea when they were going to get it?
No.
Yeah, when
Still
I
no
talked
idea.
to Ross, he said that he thought it would be a while. The places that this was maybe 3 weeks ago. So, but he said that the places that have been getting it will continue to get it, but new places are still are gonna wait a while.
Yeah, that was his response when we asked him also. He wasn't sure. I thought maybe within the last 3 weeks, he may have heard something.
Not according to the person I spoke to.
Okay, do we need a motion to accept anything right now?
Just to close the meeting.
Okay,
Move to close the meeting.
Second,
so moved. Otilia, if you're still
Hey.
on, good luck with everything. Thank you for
Yeah.
all your help and your service.
Thank you very much.
Thank you, Otilia.
It was a pleasure to have you.
Thank you. Thank you. I'll miss you guys.
Just come visit us anytime.
I probably
Yes.
will.
Don't go anywhere.
And everybody have a safe and happy St. Patrick's Day.
you're here.
Enjoy your corned beef and your cabbage and your soda bread.
Absolutely.
St. Patty's Day.
But
And
is-
your
Okay.
Easter or Passover,
Yes.
those
Yes.
will come through before our next meeting, so.
Happy Passover, happy Easter.
Mhm.
Everybody stay safe and healthy.
You as well.
Thank
So-
you.
Thank you.
Yes.
Ciao.
Bye.
Good night.
Yeah.
Bye.
Take care.
Take care. Thank you, David.
Mhm.
Thanks, Brett. Bye.
Thank you. Bye.
Thanks. Good night.